Good morning, doctors. Those that do not know me, my name is Mario Sanchez, part of the team of clinical education. Today, we are very happy to start with our first program of the region in Invisalign First. In this program, you will have the opportunity to participate in classes where you can clarify your doubts. Also, you're going to be included in a WhatsApp group. You will have exclusive access and the support of 4 speakers of our region, and they will provide you all the necessary support so that you can do your cases with Invisalign First. They will clarify doubts and will guide you through. In this group, you will only be available for you, those that participate in those training. Aside from that, will be available only during the development of the program. Very well. I hope that you can take advantage of the session and you can clarify your questions and your doubts about Invisalign First. Without further ado, I would like to introduce Maria Augustina de Nicolas. She's an expert in orthodontics and functional orthopedic of the maxilla. She is an expert in lingual technique, microimplants, and she had a master's degree in Invisalign in Spain, where she trained herself in order to give you the best of the system. Aside from that, she has 3 cases published in the Global Gallery of Invisalign. She's a reference worldwide. Without further ado, I hand the floor to Dr. Maria Agustina. How are you, doctor? Well, very well. I'm very happy to be here to talk about Invisalign First. It's an honor actually to be here and to see doctors from Mexico, Argentina, and from many countries. So I'm very happy to share with all of you all my experience with Invisalign First and perceptive orthodontics. I believe that interceptive orthodontics, I believe that is the most important part of orthodontics that we can work, because we can work with children if they have malocclusion to correct the malocclusion and also to balance the child so the child will grow healthy. Healthy child, healthy adult has no price. The majority of the orthodontics associations, they recommend that they should go to the doctor around 7 years of age, but I believe that they should have an appointment before that. We should educate the pediatrics, and also it's it's easier to develop a plan before the first permanent molar. You all know very well about facial development. I'd like to mention the stimuli, why we can have inadequate facial development. And you can see on screen the phenotypes, what we cannot change, but also we have the paratypicals, the environmental ones, the stimuli that we should treat and help our patients to change if there's something that needs to be changed. So for instance, we have respiration, and we have nasal breathing. If they do not breathe through their noses, the deglutition will not be correct, the posture will not be correct. So it's very important for them to breathe through their nose. And also breastfeeding, as it was mentioned, ideally for the children is to have breastfeeding up to 24 months, because we know that without having teeth, the suction instinct takes. As you can see the picture, you have the menton with the babies. So you need the breastfeeding stimulus, because that's very important during the first year of life. And also to take into account chewing. What I'd like to say with that. should be unilateral without the patient to chew both sides. Some just chew in one side only. So we should also provide the consistency because of the problems of breathing. They do not chew very well. So the consistency of food is very important also for facial development, and also to take into account the function towards the form. So you can see here the 4 pillars that we have to highlight, as I was mentioned. So breathing, posture, chewing, and deglutition. So we need to control all of them so they can be done correctly, as I was mentioning. If we do not provide a proper diagnosis, we might lose important features. So we need to treat so that the child can breathe well and can perform all the functions correctly. I am one of the fans of Dr. Plana, and he talks about the development, the laws of development. So you can see his laws on the screen. With this diagram, you can see the working side and the balance side. So we need to pay attention to all of that, because aside from that, you can see the balance side, the working side, and also how our patient is growing. We need to observe the mouth of our patient, the position of the nose, the neck, everything is related. You can observe here, his name is Joaquin. He came when he was 7 years old, but in fact, I would have preferred to have had an appointment with him before. As you can see, his face, those signs that Joaquin, he's not developing very well. One side of his face is more developed than the other. And as you have imagined, you can think what is happening inside his mouth. So you can see Joaquin with his inverted bite. Also very important is to control Joaquin. He came when he was 7, and with his tongue, it would be very easy to treat him if he would have come before. We could have resolved everything. As you can see, also his posture. When Joaquin arrived, we already had Invisalign first. So with 6 months of treatment, we were able to treat him in a very simple way and also to balance all his functions. But imagine that if we could have done that before, when he was 3 years old. And why to provide an Invisalign first treatment, phase 1? In fact, because of the reason why we carried out interceptive orthodontics treatment is the same when we have an Invisalign first treatment. So first we need to provide a diagnosis and to eliminate the cause, as I was mentioning before. So in order to avoid the malocclusion to get worse, and this situation would have gotten worse, and also his inverted bite, and also his whole body would have been affected. So for this reason, also the skull growth, and also to have space for permanent teeth, we have 2 methods of expansion. They're very good. The expansion that we have seen, the simultaneous inspection, and there's another one through the first molars that I'm going to show you, where in fact we can obtain very important results. Also, to avoid any problems with inverted bite, if you chew in only one side, if we do not intercept, we will have severe problems in the future. Also, Invisalign says that this is a phase 1 treatment, and later on, I'm going to show you when the patient can use a phase 2 treatment. But if we intercept with a phase 1 treatment, is going to be shorter and simpler. Extraction treatment will decrease, and also orthodontic surgeries. We know that sometimes we don't like to perform extractions, and the patient come to the office and they think that they have to wait until all their teeth are changed and extractions of the premolars. So in order to decrease the trauma, we have the protruded incisives, and in order to improve the aesthetics of the patients, so nowadays they are not the same patients that we used to have 20 years ago. I would use an appliance, and the patients used to accept that they would go to school wearing their appliances, and its speech is a problem with that. But with Invisalign is a more friendly system. I can treat the whole functional part because the aligners are very thin, and also I can treat chewing, breathing, all types of exercise since the aligner number 1. So what are the inclusion criteria? The question that is always asked. What we need to take into account with Invisalign first, 2 incisives, permanent incisives, those permanent incisives, at least 2/3 of the backbone formed. And also using temporary ones, we can use them, and also fixed. So if we wait for the aligners not to lose the temporary incisors, and also we need to have the first permanent premolars. And if we're going to treat both arches, so we need at least 3 milk tooth and at least 2 permanent teeth. And if we're gonna use just one arch, 2 milk teeth, primary teeth, in each one of the arches. So how can we describe the treatment with Invisalign treatment? So phase 1 treatment, it is indicated for patients from 6 to 10 years old with mixed dentition. We have the possibility of having all the aligners that we need during 18 months of treatment since the approval of the first clean check. This is very important because we have a lot of time to work with the patient, and some doctors, they said, well, but 18 months is not enough. In fact, I believe that we need to go back to the basis, interceptive orthodontics. We shouldn't overtreat them. We have a period of time. It should be short. And in fact, the experience that I have with children, 18 months, it's enough. And I will show you later on, I have even shorter amount of time. And as I've mentioned, is for kids 6 to 10 years old, but always to take into account the chronological age of the patient and the teeth age, because they can be 11 years old, but temporary teeth, then they fall under these characteristics. And also Invisalign say that ideally with some sort of retention for in the future for phase 2 treatment. So this phase 2 treatment, we have 2 benefits. In fact, I find 2 advantages. The first advantage is that we have 10 years. So when we approve the first clean check with Invisalign first, we have 10 years to request phase 2 aligners. Those aligners, they do have a cost. We have to pay for them, but the cost is smaller. compared to comprehensive treatment. And when we have patients that instead of Invisalign first, maybe comprehensive treatment because they're borderline patients and it has 5 years. Our first patient is Mora. She arrived to the appointment when she was 9 years old. And when I saw her, the first thing that I realized, the incisors, you can see the incisors protruded. You can see that Mora, she makes an effort to close her lips. And in fact, she came for Invisalign first. My oldest daughter, she was the first patient that I treated with Invisalign first. And before doing with my patients, I started with my children. So I had good results. So then I decided to continue with other patients. So without making a lot of marketing, another advantage, it sells by itself. You can see fast changes. Mora came because of that. She wanted Invisalign. And we started the treatment with Mora. And first we need pictures. We need x-rays. And the first thing when I see the x-rays, you can see the image. You can see hypertrophy. And one of the first things is to send the x-rays and to look the lumen. And I talked to the mother and I asked about the breathing habits. And I can talk to the parents in order to understand the breathing patterns. Well, she breathes with her nose, not with her mouth. But yes, she has a lot of codes. In fact, this is what we saw in this x-ray, the lumen here, because of those patients, they have a lot of allergies producing difficulty in breathing. And the canines, Mora, in fact, she has this atresia of the maxilla. We have the profile x-ray, class 1, skeletal class 1, hypodivergent patient, protruded incisors. You can see the negative discrepancy of the maxilla. You can see no coincidence of the midlines, the camping of the occlusal plan, negative torques, and also she had a molar canine class 1 of both sides, ideal for Invisalign first, because we want to expand and take into account with Invisalign first, we expand. The expansions are generous. We're not using disjuncture.
Desde aquí tenemos la posibilidad, con la itero, de generar una simulación de cómo va a ser el tratamiento de Morita antes de ver su clínica. ¿Ves? Así estaba Morita y mira cómo Obviamente que esto es una simulación, en el maxilar inferior como se ve, y también en el superior. Obviamente acá falta la expansión.
And after the expansion,
Este es outcome simulator, ¿sí? Realmente
the outcome simulator, when the patient arrives after diagnosis, we have the possibility of show to the parents the treatment plan that we can do in 1 minute. It's not a real treatment plan, it's just a simulation, but they can see the result because with the clean check, as you saw in our video, we can change certain teeth and also the patient can play with it and they can see and they can be part of the treatment and to understand. And it's very simpler. It's a way to show the goal. And Morita, she also had a nail biting. When the mother came, she doesn't have any habits. She's breathing through her nose. And then when you look beyond the teeth, and I used to say, you can see the patient as a whole. You should treat it in a holistic manner. And we know that nail biting also brings consequences.
Este videito se lo hacemos a todos los pacientes, le preguntamos primero a la mamá o al papá.
Patient. And how is the child breathing? Breathing through their nose. And then they should swallow water and should keep it in their mouth and without opening their mouth. And then you can see the patient, they open their mouth because they cannot breathe. So it's a very simple way to show to their parents that something is happening. And aside from that, with Altero, we have the possibility to see the progression of the patient. So the contact points, as you can see, as Mora, she chewed through the right side. As you can see, you can observe. And to summarize, she is a class 1, skeletal class 1. As you can see, negative discrepancy, canto-occlusal plant, overjet, non-coincidence of midlines, as I've said, and now she used to chew through her right side, and we started with the diagnosis, and we sent the suggestion of chewing also through the left side, and she is a mixed breather. She has an artificial lactancy and also nail biting. And when we ask the x-rays, we ask for the doctor to analyze and what to do with the breathing lines in order to be permeable when we treat our patients, because we need to treat them having also the support of the otolaryngologist. And as I've said, we need to develop the art form, we need to align, and the patient didn't like her teeth, and also to correct the overjacked, and also to create spaces and neuroocclusal rehabilitation to chew through her left side and to eliminate habits. Because Mora, she was one of the first patients, and I was very surprised that Invisalign as well avoids the patient to bite nails, because with the plastics, you cannot bite your nails. So it was excellent also for this reason. As you can see, the clean deck of Mora frontal view, you can see the expansion that we are performing, how we are intruding the 21 and the rotation of the incisors. I always like to compare, and the bibliography tells us as well, you should treat the patients early. We have to treat them according to the size of the arch very early in order to provide a skeletal, muscular, dentoalveolar adaptation. And how should I know the amount of expansion? You can use the tables that you want, the indexes that you want. I use the point index, the distance, as you can see here. And I realized the amount that we needed for the expansion. An expansion of the molars, 7.4 millimeters. And as I've explained before, what type of expansion can we do with Invisalign First? If you do not ask predetermined expansion, you will receive the expansion of the first molars. As you can see, 6 moving, A and D, and then you expand. As you can see on screen, this is very predictable. That's why we have optimized attachments for expansion control, and the results are excellent. Aside, you can look the expansion, they can be done in a selective way. You can see the right side I expanded more than left side. As I've explained before, she was chewing through the right side, and I needed to expand more the right side. And that's why we need to be very exact about the amount of expansion that we want to achieve. And this is the movement table. And I like very much to review this table because I can see if the movements that I've required are correct or not. And the table, you can see the teeth, you can see the roots of our patients, and it's very good to pay attention to both parts, coronal and the tooth, and also the roots. You have the expansion, the staging that I've talked about, the first molars first, and also to look the first permanent molars, another tip, because they have mesial rotation and expansion at the same time. The rotation, distal and mesial, we can gain 2 millimeters of spaces. So pay attention to that. And if the patient actually needs the rotation of the molars, we have the rotation of the molars. Outside the incisors, you can see the quantity of rotation of 40 degrees, and in the 21, 27 degrees. Here you have the expansion. And as I was explaining today, you can see the table, radicular level. And you need to be careful to check the mesial-distal angle, the angle of the laterals towards mesial, not distal, because of the canines. And we do not want to generate any problem. The expansion that we're going to carry out, overbite, overjet, as you can see with the rotation of the molars, I'm just doing the rotation and expansion. And why? Why an expansion of 8 millimeters? Because the torques, they were so negative, and the expansion we gained, changing the torque as well. Another important table is the movement sequence, not only for the expansion. It's very important, this table, the movement sequence. So you can see how the movements are being done. Look at this. Those teeth that are on your left side, those teeth, they are moving first. So the first, the 16, the 26, but at the same time, we are aligning. That's the reason of the appointment and the expansion that I was mentioning, and the expansion of the canines, the first and the second molars and the three together. Don't be afraid because of that. Children, in fact, you know, they are very flexible, and in fact, we can expand and we can do rotation without any problem. All the movements are very predictable. So you can see Mora, aligner number 20, and as you can see, the changes of the torques, the aligners of the incisors after the progress assessment also is another important tool that we have in Aitero. As you can see, the progress of the treatment, it's like the inspector, because if it's not, if the patient doesn't use very well, the green color shows that the movements are being done very well, and the yellow, something is not very good, and the gray, we cannot see a lot of changes. So what happened here? Everything perfect here, but here not so perfect. So I lost the attachments of the 6, and this is a good reason to realize and do the procedure that you need. Another attachment or torque, depending upon the need that we have, or sometimes if we see that the patient is not using the aligners as it should, it needs more time, in fact, so we should assess what we need at this point.
T, D, che, T, D, che, T, D, che.
Toda de vuelta.
N, S, Z, L, R, K, G, C, K, G, C. Tengo que hacer así y pasar el aire de un lado al otro, así. Ahora te voy a mostrar cómo se hace, cómo voy a hacer los buches de agua.
Bueno, esto, ¿no?
So as I was explaining today, the aligner is very thin so that we can continue with all the functions. In our office, we provide also exercises, and also we have a multidisciplinary team. We have a speech therapist to work with all the functions. The last aligner, we scan Mora and we observe the fluxogram. As you saw, she was chewing through her right side, and the last one, the occlusal contacts, you can see throughout her mouth.
Esta es Mora a los 6
This
meses.
is Mora, 6 months and a half of treatment. As you can see how beautiful the maxilla and the eruption of the premolars. And in fact, I am very happy. And aside from that, the mother was happy with the result, and I wanted to finish the alignment of the incisors. 11, we needed that, and it was a mistake. I do not know, it doesn't have attachments. If we had the optimized attachments, I could have included an attachment in order to finish, to correct better the rotation of the incisor. In fact, with Mora, it was a lot that we needed to expand, that I said, okay, let's see the scientific evidence and the expansion that we can achieve with Invisalign. As I have explained, the expansion of the premolars start first, and it was only available for Invisalign first. We didn't have in other systems of Invisalign until the 8th. But I couldn't find anything because everybody talked about simultaneous expansion and also for adult patients.
Que decidimos medir.
And then we decided to measure the Mora models. We measured the initial treatment if that coincide with the art results. So after the last aligner, the final stage, we asked for additional aligners in order to have a measure. And also everything could be done with UltraCart. Those that has Aitero, we can perform those measurements. I used another software, but you can use UltraCart. And as you can see, an expansion 37.8. That was the desirable goal, 39.6. So what that means, we achieved the expansion of 95.5% of the expectation. So this is very important. Almost 90% of the molars. So actually, I do believe that this was very fruitful, that we could expand a lot our patients with the staging of the first molars, having them moving first. You can see the final x-rays. Mora went to the doctor with the intervention of her adenoid and the canines are growing naturally. And the roots did not suffer any damage. Mora after 4 months of treatment and 6 months and a half. This is the summary of her treatment. Her pictures were taken 3 months and a half when I started with the second set of aligners. But with a phase 1, we could have finished there if we wanted. I wanted more because we still needed more time as a contention, myofunctional therapy, and always working with a multidisciplinary team. And my conclusions, you need to know the growth and the development for the expansion, the amount you need to expand, what is predictable and with Invisalign for the expansion after seeing the results of Mora. And I asked individualized, I expanded more the right side. And this is also interrupt the nail biting. I expanded with a control of torque, and I liked very much the finalization of the first step. The need to hypercorrect, taking into account almost 90%, and to check attachments and scan the patient. Sometimes the patient doesn't realize that lost an attachment, and she actually lost attachments. And maybe if she had kept with the attachments, maybe she would have gained more expansion. The neuromuscular rehabilitation and to work with a multidisciplinary team.
Lo que me molestaba de mis dientes
What I didn't like of my
muy chocos y yo los quería cambiar, no me acuerdo por qué, pero los quería cambiar porque me estaban molestando mucho. Estos, más que estos, eran solo estos y para cambiarme, por eso usé los Invisalign. Me resultaron muy cómodos. Fue rápido. Muy rápido. Y bueno, eso.
Bueno, esto, no sé, a mí me llena de alegría realmente. Ver a los
I
pacientes.
was very happy to see how happy was the patient And also the patient feels comfortable with the treatment. And this is Mora. I need to go faster because I have 2 other cases. So this is case 2. As you can see, protruded teeth. And after the appointment, the patient came, he was 7 years old, 7 or 8, I don't remember. But he was concerned because of bullying. His friends were bullying him. And their parents, they are doctors, and also he had breathing problems with apnea at night, and also he did not eat meat. When I realized the profile, the first, the retrusion of the mandible, the compression of the right side and the lower side behind the incisors, insufficient and decanting, the occlusal plan, decanting of the occlusal plan, and you can see gingival smile. And the study says that the best moment to treat the patients is between SC3, SCS4, because we're talking about men, 16, 17 years old, the prepuberal and postpuberal. We have dentovelar effects, but they could not treat him, and you can see the airway. And I needed to provide air to this patient with mandible advancement. This was CS1, but we decided to treat the patient. And in the same study, what we can find in the maximum peak of growth, obtained 4.7 millimeters of advancement in a maximum peak in a patient CS1, CS2 results 1.8. So I believe, as I've said, I could start a treatment with this patient. So the initial X-rays, class 2, brachyfacial, hypodivergent, in protruded incisors. You can see class 2, lower incisors, the contact with the palate and decanting as well. The scan, as you can see, the contact of the incisors and the occlusal plan. And to summarize, he was 8 years old, overbite, overjet, mild crowding, also habits, apnea, snoring, also sleep disorder, waking up several times during the night, mixed breathing, and was not breastfed by his mother. So what were the objectives of the treatment? Mandibular advancement, but I was not going to obtain the results that I desired as the goal of the treatment, but at least I could improve the quality of life of my patient, broadening the airways, the overbite, the overjet, correct the cunting, expand, align. We know that when we expand the upper maxilla, the mandible is behind physiologically, has an advancement. This is the clean check. And those are the position wings that we use for the advancement of the mandible. Dr. Botero also will explain everything about that. But basically, for those that have never used it, so you have an idea, is the twin block, but just advancement with the wings. And we keep the patient with the mandibular advancement. It depends how we have asked. So you can see what I have asked and how I have asked like that for the mandibular advancement. We corrected the overjet and the overbite. That's the image that you can see in yellow was the overbite and also the sequence of the movement. And that's what I wanted to show you. The sequence of the movement we have done in mandibular advancement because this was the reason why the patient came, could not breathe very well. So I asked number 1, 3.6 millimeters. This is more of what is suggested by Invisalign. Invisalign suggested the mandibular advancement to be done every 2 millimeters, 8 aligners. But I did not have another option. So one advancement, 1, and then in number 15. As you can see, the transition phase in blue, 29 to 33, where the patient has aligners and the wings kept in this position until we scan, we approve the clean check, and then we have the new aligners then. And I like to put my attachments in the aligner number 4, but it depends. Those arrows, that's what it means. So I should put the attachments, and here I should remove them. And the attachments we remove after the last aligners, after the transition phase, to keep the wings in the correct position. And also, as I was talking about the sequence of movements, the expansion of the patient is being done simultaneously. The teeth will start together at the same moment. And why this mandibular phase or from the first aligner? Because the case of Ramin were more than 2 millimeters. So that's why with the aligner number 1 and the rotation of the molars, and I did not have a crossed problem afterwards. So because if not, I would have a pre-advancement phase, and as you probably have seen with teenagers, and then the mandibular advancement. So it was better because we wanted to treat his apnea. And as I was explaining, in the blue color is the transition phase, and the gray part I like to show to the parents where the parents can see the end result of the treatment of Hamid, and we can select if we're going to do tip to tip or how we're going to do that. Here you can see the expansion, the upper maxilla and lower maxilla. I need to expand for the mandible to be free and to grow naturally. As you can see, when we have the wings, you cannot put attachments, but at least we need retention. So here we have lingual attachments. Those attachments, I recommend them to have a retention as well, because sometimes if we do not have a retention, what happens is that the aligner can fall and can flap because the patient doesn't have space. So I have good results with this type of attachments. And with Ramin, intrusion, as you remember, gingival smile, intrusion, I'm not afraid of the intrusions. As you can see, the movements are very smooth. And we have the incisors and the intrusion for leveling and the extrusion of the canines. You can see overlapping. Differently from Mora, the expansion was totally symmetric, and the advancement also symmetric. aligner number 1, you can see the compensators of eruption. This is done by the software with an algorithm to give any space for the eruption of those tooth. As you can see, the compensator of eruption, the wings,
Mis alineadores siempre sí son wings.
Perfecto, si te molestan.
No.
Bueno, ven, tal cual, ¿no?
yes. Mandibular advancement 3.5, and no problem whatsoever. We were very happy, and you can see the anterior posterior change with the position wings, and also the aligner number 29, getting ready for the second phase. Everything has improved. We still have some room to improve, but you can see the improvements achieved. This is before and after 8 months of treatment.
Entonces, haciendo un resumen, hasta esta foto.
A summary, until this picture, 33 aligners, 8 months of treatment, changing the aligner with an advancement every 7 days. In those cases, we cannot vary the use of the aligners. Should be every 7 days. And always we treated with a multidisciplinary team, a speech therapist, osteopathy, everything that he needed to be better. So what have we learned with the advancement, with the mandibular advancement with Invisalign? We had the alignment, intrusion, expanding, and with the advancement of the mandible. And it's very friendly because all my patients, they went through the pandemic with Invisalign. Was a pleasure to go to their houses to bring the aligners here in Argentina. Now everything is coming back to normal, and I follow my patients. I don't need to see them every time. And also I like the precision wings. They're very comfortable, having a minimum increase of progressive advancement to re-educate all the functions, and having this progressive advancement, it is very compatible with myofunctional therapy, having improvements in his airways because of the advancements, and also with other appliances. You can compare and see the results. And it was hard for me, for my patients. I don't see the same with Invisalign when we have the mandibular advancement, because the patients, they do not complain with the advancement that is being done.
Porque me molestaba los dientes, las paletas, sí. Porque cuando mordía me quedaban acá. Sí. Para acomodar más. El maxilar.
Inferior, perfecto. Inferior. Muy bien. Bárbaro, muchas gracias.
Bueno, ahí está el testimonio de Benjamín.
There you can see Benjamin. Now, case number 3, gingival smile. This is Chiara. When she started with her treatment with Invisalign first, you can see convex profile, hyperdivergent decanting of the occlusal plane, decompression, the effort to close. And this is Chiara. She was 8 years old. She arrived when she was 8 years old. A lot of resistance with Invisalign first. So I decided, I mean, I knew she was quite big for this balance that we wanted. So after 6 months, Chiara, she was 3 years old in this picture. This is a picture, and she always used to go to the dentist, and nobody talked about inverted bite. She didn't know about it, and they thought that they just could wait. As you can see, class 2, hyperdivergent, more difficult to treat. You can see her mandible diminished, frontal view, and you can see her bones. Moderate crowding, open bite, dysfunctional deglution because of the position of her tongue, although I tried a treatment before because we needed to expand her maxilla. So this is a summary of Chiara: negative torque, cunting, overjet, no coincidence of the midlight. He breathes using her mouth, and she was not breastfed. Gingival smile. And this is a challenge because we need to have a vertical control for the incisors and for the molars as well. So what were my goals? Class 1 of both sides, canine and molar, to level the occlusal plan, to improve the gingival smile, to correct the midline, the overbite, the overjet, and re-education. It was a challenge to re-educate Chiara, and how our patients too. I do not know if your patients know the habit of your patients, but this is very important if you want to go beyond to see how they eat and to teach your patients that chewing should alternate. This is Chiara. She's eating a cake. You can see the effort she does to chew. And the compensation to swallow, dysfunctional, a lot to work with. And the patients, they should come when they are 4, 5 years old, even before. This is the clean check of Chiara. Very simple expansion. When we expand, everything goes backwards. So to close the open bite for the extrusion of the lower incisors because of the gingival smile, I did not want to generate more smile, and the aligner helps me to control it vertically. You can see the overlapping here. The clean check, lateral view, the rotation of the molars, and you can see the advancement, the distal plan. But we had an advancement, a virtual advancement, 2 millimeters. And this is the table, and you can see the expansion. We are then correcting the midlines with the expansion, and we can have the expansion of the first molars. They move first, and the amount of attachments. I learned that when I work with children, we have the clean check with not a lot of attachments. In fact, I want the attachment in posterior molars always, if possible, because I put it internally, but with the attachments, because of the, if we have a flat behind, we can have a problem afterwards. And the movements, translation of the molars, just the rotation actually of the molars and the expansion and rotation of the molars simultaneously without any problems. Going back, you can see the overlapping and the virtual jump of 2 millimeters. I did not use elastics. I wanted this virtual leap because of the expansion of the mandible that was with this problem. And she arrived when she was 8 years old. And we wanted the expansion. Chiara, after 4 months and a half of treatment, the leveling of canting, we're going well. We need to improve the leveling and to close her bite. Chiara, as many patients after the pandemic, she had to move. Now she's in New York, and we are treating her virtually. We sent another set of aligners. She's in New York, and I see her virtually. You can see here Chiara after 4 months and a half of treatment. That's what I say. It was very fast, actually. You can see the changes and how we can help her to improve her functions, because we are almost closing her open bite. You can see vertically the X-ray, frontal view, the changes performed. And here you can see Chiara, her smile, and how better she is now. And 4 months and a half of treatment. In this picture, she was treated with a holistic treatment. The vertical control with Invisalign first is excellent. And you can also improve her chewing. And this sentence was mentioned by my husband, the canting effect with the extrusion without any problems. The case number 4 is Valentino. This patient, I saw him this week. I talked with his mother, and he has a lot of spaces, as you can see. He cannot close his lips. You can see the profile of the patient. And we talk about the need of health for the patient. He is hypotonic, unbalanced. And you can see the X-ray of Valentin. You can observe class 1, mesofacial, then incisors. You can see protrusion. And what happened? Diastema, patient with diastema, retention of the canine, no space of the natural extrusion of the canine, visualization of number 6, and lost the space. You can see here, class 2 on the right side, retention of the canine, no coincidence of the midline. And of course, he breathes using his mouth, and we needed space for the eruption of 1.3. Correct the class 1, molar and canine with distalization. Yes, it was before I used different appliances for distalization. Now with Invisalign, retrusion of the incisors, and myofunctional reeducation. So this is the clean check frontal view, and expansion, distalization, and you can see the compensator of eruption, translucid, which is the space for the canine that is retained. You can see the expansion, the distalization at the same time, and at the same time as well, I can change the midline. You can see 4, almost 5 millimeters of distalization, 6 and 5. It seems crazy, but I said I will do it. The sequence of the movement, the same sequence, the expansion with the first molars, they move first, which is my staging for the expansion. As you can see, distalization, mesialization of the lateral and the central. You can see those intermediary pictures, the compensators here for the eruption of the canine. 4 months of treatment, he's still under treatment. So we do have the 2 premolars. You can see distalization, the molar, and how it used to be, number 7, and how the 7 is, and the canine. It still needs a space. I can mesialize the lateral and the central and align those teeth, but I'm very happy because of the improvement. The current pictures, we change aligners every 5 days for patients with mandibular advancement. As I've said, children, in fact, I see it's sort of loose, so then I change every 5 days. It decreases the amount of treatment, and the patient is motivated.
¿Qué número vas? Fíjate en la bolsita, a ver. ¿Qué dice?
Es un 4 al 11.
23 de 31. Bueno, ya falta poco. Sonreí.
Bueno,
Yes, I have a lot of fun with children.
tiempo, Mario,
I do not know about our time, Mario. This is another case of the Global Gallery, and as you can see her smile, she has a gingival smile. She didn't like her teeth.
una leve clase 2 esqueletal.
Skeletal class 2, negative discrepancy, high canines. Similar to a previous case, negative torques, like Hami, the laterals, where they are, the lower laterals, and basically to expand, align, and leveling for this patient to be balanced and to grow without any problems. No coincident midlines. The initial picture of clean check. If the virtual coincides with her mouth contact point, just like Hami, as you can see. She was 7 years old, increased overbite, crowding, nasal breathing, deviation of the upper midline. So what were my goals for treatment? To develop the arch, to correct gingival smile, that was her complaint, to create space for permanent dentition. And so if the child has crowding, you have to wait. But to wait in a mixed dentition, it's not going to fix itself. It doesn't have enough space, we don't need to wait. I'm not talking about long treatment, but just an interceptive treatment. And maybe in the future, we'll no longer need another treatment. She balanced all her functions. Initial scan, initial clean check, expansion, intrusion. And as you can see, how we have used the eruption compensator to wait for the laterals.
Nuevamente, la expansión.
Once again, the expansion for the staging. You can see the molar move for staging, improving the midline, more attachments as you can see, intrusion, anterosuperior sector, and here with more attachments. Molar rotation, as I have explained, we gain 2 millimeters with the rotation of the molars. And I did not do that with molars, but we can learn from our mistakes. So I'm always learning from my mistakes. I do not like to repeat my mistakes. I try not to repeat them. But those retention attachments were necessary. Sometimes we do not scan perfectly the patients. So we need those attachments to avoid flaps. And then we will not obtain the goals of our treatment. Symmetric expansion, molar retention in antero intrusion, final scan, and the final result. Final X-ray. As you can see, we have enough spaces for the premolars, for the ones that will erupt. Final model, 6 months after treatment. Changing the aligners every 7 days. I use 25 aligners. We do not need additional aligners for this patient. I did ask for them because of the pandemic, but it was not necessary additional aligners for this patient. So she used only 25 aligners. And the result is right here. So what have I learned? To add attachments, retention attachments in 6, as I've said, and this possibility of Invisalign expanding transversally in a spectacular way with an excellent torque control and the psychological effect, positive psychological effect. So she didn't smile much. And when I treat a patient, a child, I think of my children. And in fact, I'm very touched with the changes we achieve and how happy they are. Case number 6. This patient, she is class 2 retrusion of the lower maxilla. The crowding, as you can see, what I was mentioning today, what happens in her mouth. Also, you can see the bones, the crowding, the laterals, the canines. Here we don't have space. Is a patient
Clase 2 esqueletal y dentaria, atresia de ambos maxilares.
class 2, hyperdivergent. those patients that we need to be careful when we treat them. Increased overjet, retro-incline, upper and lower incisors, and severe crowding. And what was my goal? To expand canine and molar class 1, coincidence of midlines, leveling, and align. Expansion, once again, it's very easy, as I've said, to treat the patients with Invisalign first. As I was explaining, expansion and distal medial rotation of the molars.
Expansión simétrica.
Symmetric expansion. Overbite, overjet.
Inicio.
Beginning. As you can see, after 4 months and a half of treatment, as you can see,
Cambia alineadores cada 5 días.
Changing the aligners every 5 days. And we still need 2 more months to finish. Case number 7. Juli, this is my last patient. She's 7 years old, class 2 profile. Her mother is also class 2. As you can see, her smile, the laterals, the position of the laterals, and here you can see the X-ray. So class 2, retrognatic mandible, crowding, non-coincident midlines. As I've said, skeletal class 2. On the right side, we had class 1, negative discrepancy, and she used to 2 in her left side. And my goal was to correct class 2, to have class 1, and to correct the midlines. And that's what we did. Expansion first, and then the mandibular advancement. And with this advancement to correct the midlines. You can see the lateral view of the clean check.
Miren, rotación de molares, expansión.
Molar rotation, expansion. And the advancement, and how to ask for advancement.
Número 31, 2 milímetros.
Number 31, 2 millimeters, 39, 2 millimeters, and aligner 47, 1 millimeter. As you can see in blue, pre-advancement phase and the transition phase.
La rotación de los molares.
Molar rotation. So what do you see? What is the strange here? There is a big difference with Hami. The difference, the wings are not in the same height, because what we can do with Invisalign is an asymmetric advancement. We can advance more in one side. We can do that up to 2 millimeters for the coincidence of the midlines, and that's what I asked for. She's going.
Estos son los nuevos que vinieron con Precision Wings. ¿Tienen aletas?
Sí, son como aletas.
Como aletas, muy bien. ¿Y qué tal son? ¿Cómodos?
Se van a aflojar.
¿Sentís algo raro en la boca? ¿Algo distinto?
Sí, es muy difícil cerrar la boca.
Pero la cerrás perfecto, yo te veo perfecta.
Sí, en grande ya van a cambiar los aparatos.
Muy bien. Bueno, eso es lo que nos contaba ella el día que le di.
Yes, when I gave her the first set, she felt that it was different with the wings, but she said that, yes, I will change in the adaptation of children. So aligner number 1, aligner number 50, As you can see, the mandible advancement, we still need, of this side, we need more aligners. So this picture was taken after 8 months and a half of treatment. As you can see, the X-ray, and as you can see, the eruption of the permanent teeth with more space. This is today, and her smile is changing, and she had the aligners there with the wings. So increasing the vertical dimension. The treatment summary, we change every 7 days. That's what I explained about the wings. We are under treatment. We started 8 months and a half, and we always need to work in a holistic manner with speech therapists, with osteopathy. And we made a study to see the predictability of Invisalign First in 20 patients that were treated with Invisalign First with the staging of the first molars. Children between 6 to 10, we digitalized the models in the initial phase and also digitalized the phase 2, the end of phase 1. And the software that we used, Mesh Mixer, and as it was done with Moda, this is the midline, the result, 20% were men and 20% girls, late dentition and 90 early dentition, and these were the results obtained. It would be better the upper maxilla than the lower maxilla, and the best results more than 90% in the first molars and canines. And we believe that the results obtained are very good in all the pieces, canine to molar. We have more expansion of the canines and molars because this was when the expansion was done. So those teeth, that's why I'm saying that we had the result of 80 to 90%. So those are my conclusions of Invisalign First. The patients is very comfortable, very easy hygiene, 0 emergencies. And if it breaks an aligner, there is no problem. We can use another one, and the patients are very motivated. They are very happy to have Invisalign. And aside from that, they motivate other patients. And in fact, as I was saying, not because of marketing, because children, they talk to other children, and you have like the whole school in your office, and you can do the same because children, they don't laugh of the Invisalign because they don't see. So no problem with that, as they are invisible. And also we ask, why have you chosen Invisalign? Because we cannot see them. That's why, because when they are 7, 8, they ask for Invisalign because they cannot see them. The expansion is very predictable, and I'm very fascinated if we expand when we can, and we shouldn't need disjunction, and allows controlled development of the arches and selective development. As I've said, it's 100% compatible with functions re-education, work with chewing and with the exercises in order to breathe better with the appliance. And it's very thin. It doesn't increase the vertical position. And also in the correct position, there's no problem in terms of the palate. And it's removable, and I can encourage the chewing function of the first phase of treatment aside, I believe that is very inclusive. I have very patients with Down syndrome, and I started to treat Quan Chi. He has a Down syndrome, and he's very happy, and he shows to his friends. So I'd like to encourage you all to test, and those that have seen the results, those that have done your first steps, it gives a lot of satisfaction to see all these children happy, and they're growing very well. And I hope you can ask questions. You can use the chat. Thank you very much for your time. And I do not know if we have questions. We are late, but we're going to answer. The chat is asking a lot of questions and thanking you for your lecture. I'm gonna read the questions that we have. What is the effect of the forces applied compared with orthodontics? There is an indication of the anterior closed in order to begin the treatment. In fact, I have not found an article about that. It's a question that I asked myself. The teeth movement, the speed with Invisalign 0.25 millimeters. And what I do with my clients with the eruption, I have decompensators for eruption. It gives me time to close the apse. And also, in my patients, I did not have any kind of problem of reabsorption or short roots with the treatments. And the second question is, how do you keep the teeth and the mandible in position while you were waiting for additional aligners? Well, about the mandibular advancement, Invisalign sends 4 aligners, and they have advancement, and we're going to use them. They call transition with the attachments until we wait for the new ones. I do not know in which country you live, but imagine during the pandemic, imagine that you need more transition aligners. We can ask, I do not remember the number, you can ask a maximum number of 15. So you have enough time if something happens, like what is happening, to ask for extras for your patient. It's a good option. And what I do, all my patients, my children, when I scan them for additional aligners, I scan them, I remove the attachments, and I do not know how to say in other countries, but I 0.4 millimeters for the upper and lower until I wait for the aligners. I do not know about other countries, but here in Argentina, in 3 weeks, we have the Invisalign first. It's very fast. The cases, how long does it take? In the cases of first, they have priority, right, Mario? Yes, it's faster. It depends upon the approval of CleanCheck, but the first should be approved faster because of the aligners, the manufacturing of the aligners to be faster as well. I believe that I've answered. And when I finished a treatment of Eugenia, I had a functional appliance, but I could have used the plan. I do not have plates. I do not like plates. Orthopedics for the tongue. But then the doctor should decide. Very well. The second scanner, do you do it with the attachments or you have to remove the attachments? You can do it with the attachments, but I have the plates until the new aligners. I prefer not to have attachments. And I don't like when the patient you have all the aligners in the box number 1, but then you have to remove the attachments and the patient gets tired. And here in Argentina, we put the attachments and we do it ourselves. I do not want to work that much in just one appointment, so I divide. Can you use chewies with the mandibular advancement attachments? Not the wings. In fact, no. When you are in the advancement, the chewings, the last case, just in the first 30 aligners that didn't have advancement, not for advancement, because I'm afraid they will bite them. And also to show when we put the mandibular advancement, to show to the patient how they should position the wings, not to chew them. And also if you do that, very well. Do you recommend the mandibular advancement and then the rest of the treatment? If I can select, I need a pre-advancement. It works very well when I've talked about 5 factors that we need to consider: rotations and 2 millimeters at least. And having all that perfectly, if I can expand, I prefer to expand a little and then to advance. And I prefer a pre-advancement phase, but it works very well simultaneously. But Agostina Nicolas, I prefer this way. With Benjamin, as I've said, I did that in 3.5 millimeters because of his apnea. Doctor, what does it mean in the first points for the free advancement, the last that you mentioned? But I think that here, I do not know if you have it as inverted bite. In some countries, you call it broad bite. When you have this broad bite, you cannot advance with an appliance. It's impossible. So you need to expand to resolve this problem in order to advance. This you cannot do with Invisalign. You need a pre-advancement and then the mandibular advancement. Very well. When you have the distalization, do you have any special conditions regarding the eruption of the second molar? When the 7 is high, as I've talked about, the Invisalign movements are very smooth, 0.25 millimeters per aligner. So it follows the distalization of the 7. It goes towards the back. No inconvenience whatsoever, as I've showed the eruption of the 7. And we share with friends my cases and how you're going to do distalization with 4.5 or 5. Well, as you can see, the X-ray shows no type of problem in the 7. Very well. Good morning. How about the patient when you start the treatment, if you had temporary tooth and then you have more than one change, you scan again after every tooth? You need to plan well. In the case of Valentin, it's a case that the molars that we need, the distalization, they didn't have a lot of time. But there's no problem because we can use the molar with the compensator of eruption until the eruption of the premolar. And then you can, and when it's ready to scan, you can scan again. And sometimes what I do, for instance, in one patient, I'm going to extract and I scan first. I do virtually the extraction of the lower side, and when the aligners arrive And then I do the extraction and then ask the eruption compensators for the premolars. It's important to plan, that's why. If you have questions, if I'm gonna arrive the 12 months, but then you can use the comprehensive, but in this one, 4 months and a half, he doesn't have temporary teeth. They are all permanent, and I will have time for what I need to do. So here is the same questions I'm going to summarize, but here with Invisalign first, you can change the aligners every 7 days if the patient is between 6 to 7 years old. And also the question is, why you change every 5 days and in some other every 7 days? Invisalign is every 7 days, but I was discussing about my experience, what I do in my office. We cannot change, at least according to the studies they use when we have precision wings. If you have precision wings with advancement, and then every 7, because as I was explaining today, for instance, you have an advancement of 2 millimeters. This advancement of 2 millimeters will happen with 8 aligners, and this advancement is going to be 0.25 millimeters. That's why if you change every 5 days, it's going to be very fast. And this will not be positive. So in this case, you cannot change before. But in other cases where we don't have advancement, I change every 5, but the indication is every 7. To measure the Pont index, do you have a digital program or do you do it manually through your models? In AutoCAD, you can have all the indexes with AutoCAD. For those that do not know, is another tool that we have with Aitero. It's very broad, and you have everything in digital. When you have distalization in primary teeth, you continue the distalization? Yes, you saw. I do not want to go back because of time, but if you remember, 1 second. In Valentin, the premolar occupied the space with no problem. You can see here the premolar. Here you can see an example. It does not adapt. I had the aligner, and here I have the premolar, the eruption of the premolar. And as you can see, it followed the distalization, the premolar. Doctor, unfortunately, we do not have time. We still have more questions, but what we're going to do, we're going to use this information. You're going to be part of a WhatsApp group, and in this WhatsApp group, you will have all the questions, and I'm sure that Dr. Nicolas will answer all the questions. So doctors, thank you very much. Thank you, Dr. Nicolas, for your first speech. We want to learn more, but we have 4 sessions. We still have 3 more sessions with different speakers. So we will answer your questions at this time in your WhatsApp group. We're going to add you during the morning. We will wait for adding all of you in the group, and then we'll answer the questions. Thank you very much for your presence. I hope you have enjoyed. Thank you, Dr. Agustina. And I hope to receive your questions, and I hope to see you soon and continue with the following lectures. Everything was prepared with a lot of love. You have Dr. Botero, excellent speakers, and they're gonna help you. Thank you very much, Mario. Thank you. See you later.